over to me again, and back to a kind of grumpy, groany bit. Talking about caseloads. There seems to be a bit of a consensus that caseloads are too high. I don't really hear people saying, wish I had more cases. I think we could use more cases. So, the way we feel about it at the moment is that this is the Monroe model. This is a Hackney cab, called the Hackney model. At the moment, because of the number of cases we've got, it feels a bit like this. Sort of bloated, can't really support itself under its own weight. The sheer number of cases. So there's a feeling that maybe we're not quite able to get and implement the Monroe model in the way that we would wish to, and the sheer weight of volume of cases is something to do with why we can't get there. Not only the number of cases though, there's a great disparity in the allocation of cases. So for example, there's 26 Monroe units, 15 child in need units, caseloads range from 37 in some units, 79 in others. 9 cases for some workers, 20 for other workers. Now, there might be good reasons for this, but I think it's worth asking the question, does it have to be this way? Within KIC units, caseloads range from 44 to 59. So maybe they're a bit closer to parity there. Between 15 and 20 cases per worker, probably more manageable, certainly than here in the CWD team. We've got 5 units, caseloads range from 75 and 117 cases in one unit apparently, between 4 workers. So you're looking there between 20 and 24 cases per worker. Now I've sometimes heard it mooted that maybe 15 cases is about the right amount. So what we're thinking about is that if 15 is doable, then 18 must be stressful. 21 starts to get a bit chaotic. But when you get to 24, that's dangerous. It's dangerous for the worker, it's dangerous for the mental welfare for the worker. It also feeds into kind of staff retention and that kind of thing. But also it's quite clearly not safe for the children that we're working with. So the question is, what can we do about it? Because it's been like this for a long time, right? So a gross oversimplification would be to say that if you've got a case of too many cases, not enough workers, you can do one of 2 things. You can either get more workers or you can have less cases. Now we know that we're making efforts to get more workers. We know about the recruitment and retention schemes, and that's all really positive stuff. But we're also asking the question, what about cases? Can we say, that we could reduce the number of cases we have? How do we stop people coming into the system in the first place? And we wonder about if there's some scope for that. For example, a lot of the referrals we get from schools, it might be something seemingly quite innocuous. Maybe someone hasn't come in, having had breakfast or something like this. Perhaps this could lead to a referral. And then it goes through a process of referral and assessment. But maybe that could just be dealt with at the school level. I think to some extent, schools are quite frightened. We all live in quite a frightened paradigm of child protection services. So they get frightened, they refer everything automatically into us. So it could be a case of just re-educating and having those kind of conversations with those referring agencies. So that's one thing we can do. Also, we need to think about appropriate allocation. What we've noticed here is that there is disparity between units. And maybe there's something we can do to address that through looking at the way things are allocated. We also have to think about, and partly causal to this, is the fact that some cases are more difficult to manage than others. So if you're managing court cases, that's going to be a lot more legwork than if you're just managing a sin case, for example. So that's really a question of rationalisation. Then we're thinking about, if we are thinking, just for saying sake, that perhaps we could have less cases coming into us, then what services would actually be picking up those people that aren't coming to us. And we think that might be a question of thinking about networking and also ongoing training. And it's connected with, well, who are the other services out there? What are the other projects and agencies that could be helping families at an earlier stage, thus preventing them from coming into the system? Just coming back to the number of workers, the other side of the coin, having more workers in general. Thinking about the opportunity for in-house. We know that we're going to Romania to bring workers back, and that's welcome. But what about training up our own workers? We know that we train some people up through the OU program, but can we do more of that? Lastly, with regard to thinking about reducing the number of active cases, now, I have heard it said, even among senior managers, sometimes, that we are very risk averse within this organisation. And I've put it up here, that we're risk averse. And it's on a post-it actually, because it's such a frightening conversation to have that I don't even want to have it. They can go down there. But actually, the name of this workshop week was Courageous Conversations. So in fact, I think it should go back up there. Because it's worth having a conversation about risk. What we know is that in public services, whenever there's change to public services, there has to be a consideration of our relationship to risk. Necessarily, that's part of the process. But part of the problem there is that it's difficult to have that kind of conversation. I know myself that when I've talked about, maybe we're being a bit risk averse, sometimes it can get interpreted that, I don't want to protect children. And that's not the point at all. So if we are saying that maybe less cases can come into our child protection system, then it has to be accompanied by, well, what is happening for those families instead of our offering? And I think that's really where we start thinking about what is the early help services that's available. What we don't have for this is quick wins. Because when you're thinking about risk and protecting children, it's not something that you can just leap into. But it's worth starting that conversation, I think. And certainly we have a direction in which we can imagine that we could go. And that's where we're thinking about bolstering early help services and what other creative community solutions might be available. Thank you.